Hi. A year ago today, we found out on the operating table that my cancer had progressed too much um, to operate. And I was so lucky that they had managed to find an ultrasound machine just in time before opening me up. So, in the year since then, I have had day trips and concerts and my beautiful summer and wonderful visits with friends. And we've also experienced a year of anticipatory grief. Now, last week I had a CT scan, and I wasn't sure exactly what to expect because for the last two cycles, I had to wait a week before doing them because my white blood cell counts were too low. We also had it at a reduced dosage for those two cycles. So it turned out better than it could have. There's no new growth in my colon or my lungs. There's no sign of any growth in the any new cancer appearing anywhere else in the body. I do have an enlarged spleen. That can happen when you have trouble with your liver. And about that liver, there's a new tumor there. It's about 6 or 7 millimeters big, and all of the other, how many ever there are, tumors in my liver have grown about 6 or 7 millimeters. Must be getting crowded in there. So I learned all that from the palliative care team last week, and I had to wait over the weekend to find out from the oncologist what that was really going to mean for me, right? He came in more cheerful than usual, and told me that he wanted to stay the course. Felt like this, I've been tolerating this Lonsurf and bevacizumab treatment fairly well. What had been working on the cancer, he hoped that it would continue to work. And I was like, okay, but if we know that it's hurting my white blood cells, should we maybe try something a little different, like try something new? And I asked about, I know that you can boost the bone marrow somehow. And he was like, well, we can think about that, Mrs. Wells. It will cause some pain. He probably called me Mrs. Balsam. Anyway, it will cause some pain. And so the next day, I had my blood test and I failed again. And he called me in the afternoon himself to say that I would have to delay my treatment again for another week and that he would prescribe a GCSF. This one will be called Lapelga, and I will inject that into myself at day 15. So after I've had my, 5 days on, 2 days off, 5 days on of Lonsurf, and after my second bevacizumab, then I would have this injection, and it would hopefully boost my bone marrow to create better white blood cells, or quicker, or whatever. He was also optimistic on Monday because there's a new drug that has been approved in Nova Scotia for stage 4 colon cancer patients who have already had the other treatments. And it's called fruquintinib. Fruquintinib, that one. And anyway, the side effects are much like bevacizumab. So there wouldn't be any much nausea to speak of. There would apparently be diarrhea, so that's fun exchange. Anyway, it seems like my time is stretching forward. Where at one point we thought that this current treatment was going to be my last. Now we have something else to look forward to, and we're not even starting that yet. We're still going to be on this current one. So yeah, my time is stretching out. And that means more time with my kids and my other friends and family. More sunrises and walks in the woods. Maybe another spring and summer. It's such great news. I am grateful for that. But more than one thing can be true at a time. If I'm being honest, and I prefer to be, part of me was kind of waiting for worse CT results. Part of me wants to get on with this whole thing. It seems like stretching it out is harder on on all of my family and friends who are supporting me. Now, Michael disagrees. He says that they want me here as long as they can have me. I get that. But it's also still hard on me. I'm tired in a way that's hard to describe. I've had 34 trips to the hospital for chemotherapy. That feels like a lot. I am grateful that I'm here, still here for my kids. I want to keep going as long as I can. I want to live my life. But much of this time, it doesn't feel like living. I'm just working at surviving. And then, then I feel bad that I'm not doing this well enough. Yes, there are the side effects with the GI tract, with bone and muscle aches, my neuropathy from the first chemo treatment. I still feel that every time I move my feet and legs. My hair and nails are falling apart. There's other little side effects that show up here and there. My energy is so low, and I tire after the smallest things. And yet my symptoms could be worse. Part of me says it's not so bad. I should be fine. And I kind of am fine. But in addition to those side effects, there's also this other weariness. Every cell of my body has been attacked for so long. It's like a mental, physical, emotional, spiritual worn outness. I am so glad to be here and to keep going. And at the same time, it's harder than it looks. That's all for tonight. I'll talk to you another day.